with her father. And then a new high school teacher named Marco came to town, and they fell in love and got married. But Marco couldn't earn enough for them to get by in their home country, and so he eventually made the trip across the border north to the U.S. And it took 3 years for him to raise enough money to bring her to join him in Boston. And eventually she did. Basically, when they were in Boston, he was working 2 restaurant jobs, and she was working 2 cleaning jobs. And their total earnings were about $30,000 from each of them working 2 jobs. After several miscarriages, they eventually had 2 children. And then when COVID hit, they were laid off from all 4 jobs because you didn't need anyone to clean the downtown office buildings, and restaurants were closed. And so they went from having $30,000 to having nothing. And because they were undocumented, they didn't get, they were not eligible for unemployment insurance, for stimulus checks, for any really of the federal relief. Their kids were born in the U.S., so they did get a little bit of SNAP for their kids, but they basically had no income. And right after we started interviewing Maria, Marco came down with a bad case of COVID. He went to the health clinic 3 times, and they 3 times dismissed it and said, "Nothing's wrong with you, go home." But the 3rd time, his fever and chills and shortness of breath got so bad that he was placed on Maria took him to the ICU, and then he was admitted and put on a ventilator. And for most of the time we were interviewing this family, we thought he was going to die. Because of the lack of translation services at the hospital, most of the time Maria couldn't get any update on how her husband was doing on the ventilator, during this period. Ultimately, he did get better, but he was very, very weak afterward. But the key thing here was that they had no income, like 0. And so they weren't paying rent, they weren't paying utilities, and the only way they were getting by was going to the food pantries and getting boxes of food so they could eat. And so the most important reason that this surge in food pantry use was happening across the country as COVID hit, and despite all the economic relief, is that there were people who were not eligible for this assistance. And because the COVID job loss was so concentrated in sectors like cleaning and restaurant work that employed lots of undocumented workers. Okay, so now imagine you're Tom Ambrosino, the city manager of Chelsea, Massachusetts. You run a city of 45,000 people just north of Boston that's among the poorest communities in the state. That's 47% foreign-born, which is the highest foreign-born rate in the state. That has the highest population density in the state, with many families, immigrant families, that are double or tripled up in apartments. And then the Biogen conference happens at the Boston Long Wharf Marriott Hotel in February 2020, and we get what was at the time the worst COVID outbreak anywhere in the country, and we don't know how to treat it yet. So there are lots of people in your community on ventilators, a lot of deaths. And you have perhaps 10,000 people in your community who were like Maria and Marco. They literally have no income, and they can't get any food. What do you do? Well, I'm going to turn it over to the film to tell the next part of the story. All right, well, what I hope to do now is show a lot of numbers that I hope are as compelling as that film, or at least the combination I hope will tell the story of what happened in a richer way than either by itself. But it's a pretty remarkable story you just heard about public sector innovation. This city manager saying, why don't we just let people go to the grocery stores? Like, we have grocery stores, we give them money, let them shop for themselves. We don't have to be handing out these boxes of food. Okay, so what I'm going to do is, well, first I need to talk about my co-authors. So the main paper is joint work with Catherine Carlson, Eliza Novick, and Pamela Portocarrero. And then there are two spin-off papers that I'll briefly talk about. There's a nutrition analysis where we had people do a 24-hour food diary, and to analyze that, I needed help from nutrition experts. And so I have a couple co-authors from the Harvard School of Public Health, Matthew Lee and Erica Kenny on that work. And then we have some really new work that involves matching to the electronic medical records of folks to look at healthcare utilization, and that's joint with Sumit Agarwal, who's a practicing physician, but also a PhD student in health policy at Harvard and also on the job market. So if there's anyone here from the medical school, you should hire Sumit. And I want to thank the Shaw Family Foundation, which funded both a lot of the actual cash transfers, but also our research and along with the Rappaport Institute. So here's what I want to do. I think I'm going to mostly not show you a lot of technical details about how the RCT was designed. I'll go through those slides pretty quickly. But I basically want to show you three sets of results. I want to show you a little more about how bad things were at baseline in this community. I want to show you, by following the control group, the people who didn't win the lottery, show you how the situation was evolving in the community over the period that we're studying them. And then I'll show you the experimental impacts, the difference between what happened to the people who received the Chelsea Eats cards and the people who lost the lottery and didn't receive them. And there's sort of four deep issues that beyond simply what was the impact of this really interesting program in this really interesting time that I like to talk about. One is there's a big literature about why it is that the diets of low-income people in this country tend to be less healthy than people with more resources. And so what's the causal impact of income on diet? And this helps us think a bit about that. I also, there's sort of the cost-benefit analysis. If you're in a crisis and you got to get people food, should you be giving them cash or should you give them boxes of food? And I want to reflect a little bit on that and about the question of like whether we should have food pantries at all. Like, why not just give people money and cash? And we got grocery stores. I'll explain to you why I actually think we still need to have food pantries. The third thing that I think is a pretty powerful theme here is just remembering what it's like to have a big set of workers in this country. You don't have a safety net, the undocumented, and you get that out of this research. And then the fourth thing that's that if we have time, I'll talk a bit about is, most of the guaranteed income and basic income types of pilots going around the country are pretty small, and they're in really big cities. Because this one was big and in a very small city, 16% of households were getting income in this experiment. And so there are things you can see about transfers between people who won the lottery and ones that didn't, that you can study in this context that you can't study in some of the other experiments going on around the country. So those four things, I may get to them, or you may have to raise them in the question and answer period. I'll definitely promise to give you all the stuff in the middle, the main outcomes, but we can decide which themes you want to talk about in the discussion period in about 20 minutes. Okay, so basic idea: 3,600 people applied for the lottery, mostly standing in line, waiting for food boxes when they were signed up to participate. We then, before the lottery happened, invited people to participate in the study. About 2,000 agreed to participate in the study. About 1,100, 1,200 who won the lottery, and 700 who didn't. And so most of what I'm going to do is compare the ones who won the lottery to the ones who didn't. I don't have to tell you about the lottery. You actually saw it already. This is the card that they got. Most households receive $400 a month for 9 months. One-person households received 200. Two-person households received 300. And you could spend them anywhere that Visa was accepted on anything. You could not withdraw them for cash, but you could spend them anywhere that Visa was available. Our research was 6 surveys. And basically, we did one before randomization, a baseline. We did another one that was after randomization, but before they got their cards. And then we did some short ones that were honestly mainly designed to keep in touch with people, but they allow us to tell the story of the evolution of this. Every time people took a survey, we gave them $20 gift card for participating. And we were basically in the sort of intermediate surveys, we were able to get 90% of people to participate. We didn't really want to bug too much the last few percent because we really wanted them to be around for our final survey. The final survey, we were able to get 95% of people to participate. And then we have administrative data on where people spent the cards. We have school attendance data from the Chelsea Public Schools, and we have healthcare utilization data. I'm going to not tell you all the technical details, like that the covariates were balanced. You can read the paper or ask me some other time. Okay, so the sample is about 81% female. It's 90% Latino. 78% have children in the household. The level of education is pretty low. A third less than high school. 22% have some high school. 27% are high school graduates. And so it's, as you might expect for a heavily immigrant sample like this, low levels of formal education. Okay, so I'm going to take you through the impacts in a few minutes, and I just want to emphasize that when we pre-specified outcomes, because when you do a survey like this, you can measure almost anything about these families, but then you don't have statistical power for the main outcomes. So what we did is we pre-specified 5 key primary outcomes, most of which are indices of multiple survey questions. The first 3 were basically meant to measure the impacts that the program was trying to have. Were people more satisfied with the food they were getting? Were they more food secure? Were they in financial distress? Then we sort of just guessed 2 things that you sort of hoped giving people money might impact down the road, physical and mental health, and how their kids did in terms of school attendance. So those were the sort of the 5 key pre-specified outcomes. There's another couple outcomes that we didn't call our primary outcomes because you don't know which direction they should go in. Employment and diet quality, but I'll show you results on that as well. And then there are a bunch of secondary outcomes. And just to sort of preview, we basically find effects on the primary direct outcomes that were the purpose of the program. We do not find effects on the downstream secondary outcomes. Okay, so let me now take you into the data, and I just want to emphasize again how severe a situation these families were in at baseline. A third of them had already been affected by COVID, way early in this pandemic, and 5% of households, when you ask them why they had had a financial hardship, it was because of a death of a household member. I mean, so this was, just, we forget what COVID was like in those first months sometimes. And it was such a severe disease at that point that was, literally killing lots of people in this community. 82% said they'd suffered a financial hardship, mostly from losing jobs or from having their spouses losing jobs, but also for prices going way up. And again, if you remember that early period in COVID, the trying to get food at the supermarket was really hard. And if you didn't have a car to get to a big supermarket and you're trying to get meat at the local bodega, the prices were just going way up. Okay, and just, I guess I said this in the video you just saw, but I mean, this level of food insecurity is just sort of stunning in the US population. The standard 1-question food insecurity question has 4 categories. You want to be in this category, enough of the kinds of food we want to eat, which means you have enough food and you can get the food you like to eat. It's the second category is you have enough food, but it's not the kind of food you like to eat. Then there's sometimes not enough to eat and often not enough to eat. And about half of these households sometimes or often we're not getting enough food to eat. The US Census Bureau was doing a pulse survey throughout the country during this period. And so you can compare at exactly the same time period, Massachusetts-wide, what was going on. Massachusetts-wide, it was only 7% not getting enough to eat. So this was sort of 7 times the level of food insecurity that was going on statewide at that period, and similar numbers for just heartbreaking numbers for kids here. Over 50% sometimes or often not getting enough food to eat. The other thing I would just want to emphasize about baseline is how badly these folks wanted to get back to work and wanted the economy to reopen. Only about a third of them were working for pay at baseline. 53% were not working and wanted to be working. And among the ones that were working, 64% wanted more hours. So, the economy was reopening slowly, but the restaurants weren't giving them full hours yet or anything like that. Okay, that's baseline. Okay, how did the situation evolve? Here's the unemployment rate, the official one, according to the US Labor Department. When the before COVID, really low unemployment. The economy shuts down. It goes up to 21%. By the time we're interviewing them at baseline, it's about 15%. And even by the time we're doing the final survey, it's still pretty elevated at 8%. The way I like to think about what's going on in this community as we're interviewing them starting in September 2020 and then going on is there's a period where the economy is reopening and it's not that things are getting better, they're getting worse at a slower rate. So people still aren't making enough income to pay their rent. But instead of like being able to pay like none of their rent, they can pay like a quarter of their rent. And so their debt's sort of going up. So they're still, the financial situation's still getting worse. It's just not getting worse at quite as bad a rate. And you can sort of see this in would you say you're better off or worse off financially than you were last month? The rate at which people are saying worse is going down. But it's basically moving to about the same. And you have to get all the way into April of 2021 before you get a month where more people say that things are getting better than getting worse. And so it takes a long time for things to not simply just be getting worse at a slower rate. On food security, and again, this is focusing on the control group. This is what I'm showing you here to show you the evolution of stuff over time. It's actually getting better steadily. And it's basically people moving from not having enough food to having enough food, but not the right kinds. And basically what's happening is the massive food relief that you saw going on there is helping. It's helping people get these boxes of food, but it's still not for the control group giving them the ability to buy the kinds of food that they are used to eating or want to be eating. Okay, I think you saw enough about the card spending in the video that I will skip this section and get into the key experimental impacts. So we have 5 main experimental impacts. The 2 that came in statistically significant are that the index of financial well-being, these tables all are going to have the same structure. There's going to be a treatment group, which is the people who won the lottery, a control group, which is the people who were unsuccessful in the lottery, a difference, and then for those of you who know what a p-value is, we'll give you your p-value. And so you can see that treatment group looks better on the index of financial well-being, and I'll show you the subcomponents in a second. The food insecurity measure in April does not show statistically significant difference from getting the cards, but I'll show you there's an interesting time dynamics to that. The food satisfaction does show an improvement from getting the card, and then, as I said, no impact on the 2 downstream outcomes. So I want to go into a few of these things in more detail, starting with food satisfaction. So this definitely did get people more food and more happy with the food they were getting. This is the 3 components of the 3 specific survey questions that made up the index of food satisfaction. You can see the percent that were very satisfied with their family food situation went up a little bit. The ones who said that their situation was better than 6 months ago is what's really driving the statistically significant result in the index. And we're also, the people getting enough of the kinds of food we want is also going up. And behind this is basically that people are spending more on food. And so there was a statistically significant increase in how much people are spending on food. And you can actually compare this increase to what we saw about how much of the cards were getting spent on food, because you might want to ask, of the money they're spending on the cards on food, is that incremental spending, or is that people just spending the cards on food, but they're spending, that means they don't have to spend other money on food and they can shift what they're spending. If you do the math and you compare this to what they spend on food, about 75% of what's being spent on those cards was incremental food spending, not just replacing food they would have bought otherwise. And we also see them consuming more fresh vegetables, more likely to get fresh meat, more likely to get to eat fish. In the spin-off paper around where we look at the food diary, the stunning thing is that we see an increase in calories. I mean, that's just not something you usually see in the US population when you're studying nutrition. Usually you're studying, are people eating healthily? But the control group here, if you sort of do a demographically adjusted population in the NHANES, a national survey, you'd sort of expect people to be consuming about 2,000 calories a day. The control group here is only consuming about 1,300 calories a day, and the treatment group consuming about 1,500. So this is closing about a third of the gap in calories between our population and a typical population in the US. And we also are seeing increased consumption of fruit and vegetables, of fresh meat and seafood, and of the same things that came through in the survey also come through in the food diary, where we make them record everything they ate in the last 24 hours. Okay, so the sort of main point of this card was to let people get food, and that does seem to have happened. When you use the standard food security measures, the USDA measures, we see a big improvement in food insecurity in the December survey. We see sort of a moderate one in the December and questions about kids, and in the February questions about kid food insecurity. But by the time we get to April, we're not seeing a statistically significant difference, possibly because the economy is opening up, possibly because the rest of the food relief is robust enough. But that's what's going on in these data. On the financial well-being index, there's this overall effect, but it's basically, we had 6 subcomponents in the index, and 3 of them are sort of showing pretty clear results that people are better off, and 3 of them basically aren't. So the things that are driving the statistically significant impact are particularly the question, are you better off financially than 6 months ago? But also your ability to pay for a $300 emergency expense and your ability to pay full utilities. Those all show improvements. And in contrast, we see basically no impact on your ability to pay all bills, your ability to pay full rent, or on whether you delayed healthcare or prescriptions. And remember, we pre-specified this index before we saw any of the data. And what I think is going on here is people were, in extreme financial hardship. They got some assistance. They spent it almost entirely on food and on clothing. It wasn't enough to then also start paying your rent more, or certainly to be paying all your expenses. The lack of effect on healthcare is actually, this population was pretty well covered in terms of health insurance, because Massachusetts has a special program for a health insurance program for undocumented workers that most states, undocumented families that most states don't have. And so I think they already, 86% were already able to, even the control group, 86% didn't have an issue paying for prescriptions and healthcare. And so I think there wasn't that much room to move. But interestingly, in the health medical records, these are preliminary results that we're still refining, because we're still adding extra medical centers. To get the comprehensive medical records, we need all the different providers in the area to share their data, and they're gradually doing that. But we only have about 85% of coverage right now. But what we're seeing in the medical records is big reductions in emergency room use for the people who got the cards. And it seems to be 2 things going on. One is they don't have as many behavioral health problems, so they're not showing up because of drug overdose or excess alcohol use or other mental health problems. And secondly, some diversion to outpatient, particularly specialties, where the extra dollars seem to be enabling them to pay for transportation costs and maybe for copays. And so I think we're seeing, anyway, so it seems like we're seeing stuff in the health data, even though we don't see anything in the survey questions about health. So the survey questions for health show no impact on the standard one question, is your health excellent, very good, fair, or poor, or on either the questions about anxiety or depression, either. So anyway, stay tuned. More to come on the medical record health outcomes as we finish that research. Okay. Last thing I want to talk about is I guess if you study cash transfers, you have to tell everyone that people didn't stop working. They didn't stop working. That there was no negative effect on employment. But then I want to talk a little bit about secondary outcomes. And for these, when you measure a lot of things, the chance that you have a type 1 error is significant, that these might be false positives. So I guess I should say false negatives in this case. But there are a couple of them that are intriguing enough that I just want to mention them. The chance that the percentage of people who moved since baseline is 1/3 lower in the treatment group. Again, potentially consistent with people not being in as much financial distress. And then sort of in addition, there's this interesting result that people in the treatment group, 3% of them were pregnant and only 1% in the control group. And the last time I presented this seminar several months ago, I interpreted this by saying, maybe when people have more financial resources, they can get on with their lives and their plans to have kids. And a grad student came up to me afterward very respectfully and said, Professor Liebman, I think you might have the interpretation wrong, that when people have insufficient calories, they tend to have miscarriages. And maybe that's what's driving the result. And so I don't know which of those stories is right, but we're now trying to go into the medical records and try to distinguish between those two as well. Okay, so I have lots of other things I could talk about, but we want to open this up for discussion. So why don't we take questions and discussion, and I'll figure a way to weave other things I want to say into that as we have the discussion. Thank you.
Hi, I'm Sadie. I'm an MSW student here. Thank you so much for your chat today. Early in the movie, we saw kind of City Council's role in getting this program rolled out. And I was wondering what role, if any, you had in the policymaking process of this. It looks like even though it was a widely accepted program, a lot of people supported it, there was still a lot of debate over it. And I saw that the city manager had to frame it as not universal basic income in order to get that passed. So what role did you have in that, if any, and what recommendations would you give to someone else trying to implement this type of policy change on the policy level?
That's a good question. I did not have a big role. I was in conversations with them about how should you set up the cards, and how do you verify that they live in Chelsea, and so I was involved in some of the technical policy about how to actually implement this, but I was not involved at all in the politics in the city. I mean, I was aware of what was going on, but I was not involved. I guess the thing I would say about the politics here is there are always going to be groups in society who are too unpopular for our leaders in Washington to want to support them. And so the challenge here is, even though we need to have a safety net for undocumented workers, I mean, these workers are serving us when we go to the fancy restaurants. They're cleaning the Apple store when we go to buy our iPhone, and yet if they become unemployed, there's no unemployment insurance. And the politics are that Washington's not going to take care of them, in the same way that people in Washington decided that you couldn't get disability insurance anymore if the reason if you had a disability was that you had a behavioral health problem and an addiction. And so I think it's really important that we have a part of the safety net for the people who are too unpopular for the main safety net. We can say, why don't we just make sure everyone gets SNAP? The answer is because Washington is going to decide that some people are not popular enough to deserve assistance. And so my reason for why we need the food pantries and we need to give the ability for local leaders to have unrestricted resources to give out cash is because you can sort of say, yeah, Washington will give you money to local, you guys figure out who to give it to. That's okay. But if you actually name the groups you're giving it to, it probably wouldn't be politically feasible. And so that's my, I think, one insight about the politics here.
Hi. I just had a question. In the video, they were talking about some of the people who owned some of these establishments in Chelsea were benefiting from the cash. And I think you alluded to this too. So I'm curious how you thought about the control group essentially being impacted by the money, if they're part of the community and potentially kind of benefiting from spillover effects of the money.
I mean, certainly the community is benefiting as a whole. I get a little uncomfortable about selling the money sticking in the community number too high. It definitely is when it's going to the local stores, but when you're going to the big supermarket chain, I mean, a third of the dollars got spent at a single supermarket. And certainly that makes it more possible for them to hire workers, but I'm pretty sure the incidence of spending at a big supermarket chain is not primarily local. And so there's a mixture of what's going on. Some of this money I think really is making a difference to the economy, and some of it is almost certainly, that's not the reason to argue. The reason to argue is it's making people able to consume more food. The one thing you might find interesting about spillovers is somewhere here I have here's the right question here. Did you receive money from relatives or friends in the last month? So this is in April. Sorry, I guess September and measured in March. And you can see that the treatment group, there was a little bit of a decline in whether they were receiving money from relatives or friends, presumably because they were a little better off and they didn't need it as much. But the control group, there was an increase in getting money from relatives or friends, which I'm interpreting as people in the treatment group sharing with other people in the community. So I think you do see that kind of, I think this is some evidence of that kind of spillover.
Thanks for the wonderful talk. Actually, this is a good segue into my question, which you alluded to a little bit about time trends. And I'm just wondering, in terms of some of the impacts that you described having to do with food insecurity, food consumption, whether there were impacts right at the beginning in the first month or two, or whether the largest effects were at the end when families had received more dollars. I'm wondering if any trends stood out in the data that.
Yeah, I mean, my best guess is that it mattered the most in the early part. I mean, just partially, I mean, the real evidence for that is that the food insecurity impacts were large and statistically significant in December, but not by April. So my guess is, and you know, the economy is generally still gradually opening. And so I think this program was most important at the beginning. But part of the reason that it was extended from 6 months to 9 months was it was quite clear that conditions were still really tough in this community, even as we were getting into month 5 and having to decide whether it was over or whether to continue it. And so, but yeah, I think the impacts were almost certainly the largest at the beginning. You know, the other time that there was sort of a time-specific thing that just became clear when we were out in the field is there was a period where the schools start reopening and families needed the kids have grown, so they didn't fit into their old clothing. But when you're, you know, all at home and doing things on Zoom, that was okay if your pants only came up to your, to your knees or whatever at that point. But all of a sudden, the families had to go start spending a lot more money to spend on clothing to send their kids back to school when the schools started reopening. So I think that was another period where a sort of need arose as the study was proceeding. Oh, go ahead. Oh, you go ahead.
So, Kathy started getting into this, and then about the community level effects. I was just curious if you had thought about, I know there's this data on like credit and debit card expenditures at the Federal Reserve that you can look at low levels of geography, like Nathan and Raj have some of this. And I wondered if it would be possible to look at like credit card and debit card expenditures for Chelsea as it rolled out, and if you could see some of the community level effect, or if you thought about any other ways of assessing like more money circulating through the economy since they brought that up.
Yeah,
but it sounds like you think that's not.
That's well, no, I mean, it's an interesting question. Yeah, I'm not sure I have an easy way to do that. So I'm very interested. So let me tell you another interesting result that this is not really your question, but I'm going to tell you anyway.
I have one more question. I'll piggyback while you're
All
looking.
right, well, let me show you this one and I'll do that. Okay.
Oh yeah, actually, I wanted to ask about this one.
Here's one of the, other than the understanding the pregnancy thing, the other thing I'm most curious about my own results is that the treatment group was more likely to be using the food pantries than the control group. I basically have 2 hypotheses about this. They're pretty obvious. One is that getting a box of potatoes and onions is more valuable if you can afford cooking oil and a little meat to put with it. And so that could make it more desirable. The other is if the community is taking care of you with these cards, you'll feel like it's also taking care of you. You know, you're just more plugged into the relief and you're more likely to overcome stigma or whatever it is and go to so either of those could be true. I just want to emphasize that the treatment group's less likely to have most of their food consumption coming from the food pantries. So they're sort of combining cash and food pantries sort of in an interesting way. So the only thing I've thought of to try to get at whether it's some kind of this community level social feeling is I'm in the process of checking voter registration and voting to see if people who got the cards were more likely to vote afterward. So that's the one thing I have along those lines.
Yeah.
But
Yeah, I'm guessing you didn't ask about trust in government in the survey
we did not,
or
yeah.
anything. Yeah, but that would have been interesting. The other one, I was curious about the levels of means tested benefits. I know you've sort of stressed that a lot were undocumented, but I'm curious in the covariates, like what fraction we're getting SNAP or we're getting unemployment insurance, and we don't have to actually look.
Let's see if I can produce. Let me not produce that in real time. So I have the ability to tell you that. I can't do it off the top of my head. Yeah. Well, let me say one other policy point here about the sort of food pantries. So my view is food pantries are essential. There was a period of time when I was working on this and I was like, we should replace food pantries, just give everyone cash and shut down the food pantries. But then I decided to go spend 3 days hanging out at food pantries before I started writing that. And what I came to believe, having now hung out and thought about this a little more deeply, is one, we need food pantries for the reason I said about unpopular demographic groups. Two, their food pantries are doing a lot more than just give out food. They're dealing with social isolation for people who might not otherwise be connected with other people, and they're connecting people to other resources. And I think that's incredibly valuable. And third, for those of you who are economically minded, if you made cash available to everyone, some people who are in less need than the people who show up at food pantries might show up to get it. And so it's a way to target assistance at people who really, really need it. They're willing to go take a box of food. So all those reasons, I think food pantries actually are good things, and we shouldn't replace them with solely giving everyone cash. But I do think every time we give someone a box of food, we should also give them $10, because the food is so much more valuable if you can go buy the cooking oil, and because people have needs. It's just so hard to predict what needs are. And so does this family need diapers, or do they need medicine or whatever? And so I think we should, every place we're giving out a box of food, we should also be putting $10 in that box. Is my policy view based on this.
Hi, I'm Karina. Thank you so much for being here. So I think in the film you shared, like, the program was super successful because the city officials had built trust with the local community. And so I'm curious to know if you happen to know, like, how it is that they were able to build that trust between city officials and the community. And two, based off the research, you talked about the direct impacts were food and financial distress, but the secondary impacts were housing instability, pregnancy, lack of access to finances, and school attendance. So I feel like these are all factors that affect people who are impoverished, who don't have enough finances to just be able to survive and live every day. And so I'm curious to know whether the city had conversations around how they can address these other factors in a proactive manner versus just being like, hey, we know you don't make enough money, so we'll at least feed you so you can survive.
Yeah, those are good questions. Wait, I just forgot the first one because I was thinking about answering the second one. Say the first one quickly.
Yeah, the first one was, now I forgot. Yeah.
Oh, building trust.
How did they build trust?
So yeah. No, that's a great thing. So, I mean, a big part of the story is Lourdes. I mean, you saw her there. I mean, she's just was an amazing staff person there who I mean, she's really extraordinary. But I think for those of you who may be involved in social policy, the key thing to know about doing social policy is, if you want to reach out to people and tell them about the availability of things in your community, just translating an announcement into another language and putting it on a website is not good enough. And what they were doing is throughout this, and then you may not have been able to tell, but some of those videos were like little videos they taped and recorded and then they distributed through social media. I mean, if you want communities to know that like things are available, you actually have to do real outreach campaigns. We were doing my government performance lab was doing a project with the city of Chicago during the pandemic where there was all this housing assistance. And if you looked at the people in need in Chicago, about half are Black and half are about Latino, but the housing assistance was going like 92% to African-American households and like 8% to Latino families, because all they did is translate. They didn't do the outreach. And so we helped them do the outreach, and the second wave was sort of more close to 50-50 in who was getting benefits. And so I think that there's just, you got to have that function in government, and there's a whole story about. I mean, this Tom Ambrosino, the city manager there, is an extraordinary leader, and he was 8 years or so into his time, and so all the things the cities had done to improve the city even before the pandemic, I think, laid the groundwork for this. All right, I'm going to take this question. Your other question was too hard, so I'm going to take this question first, and maybe I'll figure out a way to answer it in the next one.
I was kind of curious the one part in the movie where they were doing the town hall, and I don't remember which city council member, if it was a member of the public, was kind of stated carte blanche that they thought just giving people cash was bad public policy. Yep. But your research kind of shows the opposite of that. And I was wondering if you had any thoughts about how research like this might move the needle, because we kind of have this the Overton window is that we have this faith in free markets and individual decision makers doing what's best for them, but then it almost seems to invert when we need it most, when people are most in need. It's oh, we can't just give them money, they'll spend it on alcohol or drugs or whatever whatever the rhetoric is. But this kind of shows that they do spend it on what they need. So I was wondering if you had any thoughts on your research or just the larger discussion of like how like, you know, because they talked about how the food pantries, most of the costs went to non-food related costs. So we have, you know, all these market mechanisms for distributing food, but then when people need it most, we kind of work around it because of all these, you know, maybe public sentiments about cash assistance. So
that's a great question. First of all, I almost feel embarrassed when I show you these results about them spending it on food or the fact that they don't stop working, because I'm like the 100th person to show this. And you have to show this in every study, but like it's not news. Like every time we study giving money to poor people, they go spend it just the same way you and I would. They spend most of it on necessities. You know, occasionally they're too busy to like buy beans and rice, and so they get takeout from McDonald's to feed their kids that night on the way home from school. And then guess what? They occasionally pay for dessert or something, or you know, because everyone deserves to, you know, enjoy life a little bit. I mean, you know, I don't know, probably 100 people have shown this, exactly the same thing I showed in this study. And so that makes me a little pessimistic about the incremental impact of my research changing the policy debate. But, you know, the policy debate, I don't think is quite so hopeless, because there really is a long trend on the market side of we shouldn't be paternalistic, we should just give money. I mean, Milton Friedman basically, you know, promoted the negative income tax and said, just give people money. We don't have to have this government bureaucracy to administer it. Let's just give people money and get out of the way, and we trust people to make good choices. And so I think if you're clever in the political debate, there is some hope for these kind of approaches. But you know, we recently obviously had this period where we had the expanded child credit, and then there was the vote to make that permanent or not. And you know, the key senator who wouldn't supply his vote for that we needed, he made the argument that if you give people cash, they're going to spend it on drugs and have opioid overdoses and die. And so I'm not going to vote to give families with children money. It's sort of a bizarre argument. I mean, if that really were true, that if you give people money, like it causes them to like die of opioids, we should like cut the minimum wage and take money away from everyone. So they don't, I mean, it makes no sense as an argument, but it was the argument that was made. And so you're right that we have to like just continue to point out that people spend money in a way that seems like low income people do exactly the same thing you would do if you got some more money. You'd deal with necessities first, then you spend on things that are a little bit less, lesser level of necessity. And there's just no evidence that people are being any more irresponsible with the low income people are any more irresponsible with their money than higher income people when they get some extra money.
I'm still thinking about your suggestion that every time you give people food at a food pantry, you should also give them money. I think that would have a good effect for the people who got the money, but I think it also would have a good effect for the people who are running the food pantry. Like the more we practice giving people money, the more we can kind of address some of these effects, I think, in terms of what our cultural expectations are. So I'm going to ask Maya and then come to here. And I think that'll be these last two questions.
Thank you so much for this talk. It's been really incredible to learn about all these results. I was curious, and this might be like a little bit vague, but I'm curious about what role you think like the framing of the program as like Chelsea Eats played in your results, whether it's receiving free food boxes or just, you know, the incredible results you saw on food satisfaction, diet quality.
Yeah.
So
the question, which the very good question I think you're asking is the reason so much of the money was spent on food that they either felt like because of the name of it, they should be spending it on food, or maybe they didn't even realize that they had the flexibility to spend it on other things. We definitely see, although through that entire period, most of it's getting spent on food, the first months, more of it's on food, which could either be that the need was greater early or that they hadn't quite figured out how to spend it in other places yet. So I can't really answer what was going on in that dimension. I think that the one place I can get a little bit at your question is I can also see where they spent the $20 gift cards I gave them that weren't called Chelsea Eats. They were just called gift cards. Thank you for taking our survey. And for that, I can see the control group and the treatment group. And so I similarly see very high rates of spending on food, not quite as high as on the Chelsea Eats cards. And the control group that didn't get the Chelsea's card spend more on food out of those than the treatment group, which all I think makes sense. So I think the answer's got to be that some of what you're saying is going on, that there's some mental accounting or not understanding the program at the beginning that probably led to more food consumption. But even late in the program when everyone understands how this has been working because it's 8 or 9 months, it's still the largest place that people are spending these cards is on food.
Some practical support for giving people cash. I run some projects to do food rescue in the Ann Arbor community. And early on, the school buses went out and had boxes of food to give to people. And the interesting thing was that after a few weeks, the people stopped picking them up. And so our project would pick up like 1,500 pounds, 300 boxes or 5-pound boxes, and take them into Detroit where they could get distributed. What was also interesting is in a couple of things. One is that in the box, in each box, every time, there were like 2-pound bags of frozen food. And I gave a few boxes to my neighbors and they said, stop, there's no way we can use all that much. And the other thing, one of the requirements was you had to take 2 gallons of milk. Well, again, the families couldn't utilize it up. So we had a government program trying to help, and a lot of money was potentially wasted, although we were able to save, take us somewhere else. So again, good intentions, but if people had,
but if people could have made their own choices about,
they could have made their own choices.
I have some. I think I have it in this deck. How much of the free food were you able to eat? So this is at the peak in December. This is really after they've just gotten their first card. So the people who are using food pantries, 57% used all the food, 28% used most of it, 8 or 9% used half of it. How satisfied? 62% satisfied. What would improve the food you received from free sources? More food overall was rather small. More variety was very high. Foods we're used to eating, foods we know how to cook was high. More fresh vegetables was very high. More protein meat was very high. Food that was not stale or rotten or doesn't go bad. So, because there's this tax credit if you're a grocery store and you donate your stale food, you can get a tax break equal not just to the cost of the food, but half of the profit. And so there's a big incentive to participate in these programs. So I think I think your description is consistent, that people, they're really grateful for getting free food, but they would be happier if they had a little more choice over what to get. The other thing I'll just mention is in terms of barriers, why didn't you go get free food? You can't show up at the right hours, you can't get there. Transportation was a big deal. And then we actually see a big dip in free food use in February because it's just too cold, and people just don't want to go get food in that month. So all these things are sort of common sense, but we can put data to what you probably knew intuitively from your work.
Hey, Jeff, I'm going to take the director prerogative and ask just one more big picture question about there's a grand experiment with cash transfers that the federal government really did. Child tax credit, expanded UI, EIPs, and I'm curious where you think we are with the questions of, it seems like strong hardship results, relatively small or no employment effects, maybe, inflation continues to be a concern folks have. So yeah, I'm just curious, like what you think we learned from the bigger picture, and feel free to mirror if you.
Yeah, when I was just getting started on this research, I was very, feeling very engaged because I cared about, the crisis we were in and being helpful. And we were, along with some of the things I showed you, we were collecting data the city was using to respond. But I sort of started thinking, what's the end game from a research standpoint? I was sort of thinking, hey, if everything went right, maybe 10 years from now, we could get a refundable, larger child credit. And then I'm still working on the study and we have it. And I'm like, I didn't even need to do the study. We already got the policy I wanted, and unfortunately it went away. But I do think if we would just go back to that temporary increase in the child credit, and if we would increase SSI by 20, 30%, and the Biden administration heroically was able to increase SNAP, we'd be much closer to the safety net that I think we should have in this country. So we're just not that far. We were 1 or 2 votes away in the Senate from having the child credit be popular. Mitt Romney was pushing something pretty similar. And so I think I think sometime we're going to get there when the stars align in Washington. And I think as we're heading toward the Social Security reform debate coming, as the trust fund is gonna be short of resources in 2035, I think there's going to be a chance for us to remind people that if we're going to be having to adjust Social Security, we should be targeting resources at the most in need retirees and disabled folks. And so maybe we can get get SSI to be at a more robust level too. I don't know. That's sort of how I hope this might all play out, and how we might all contribute a little bit to it through our research. Yeah.
We look forward to all of that happening. Thanks so much.
Great.
We'll see you next week for Jerry Davis.